Hello, I'm Dave Harmon from MarketScope, and I'll be reviewing the results from our survey of U.S. orthopedic surgeons completed during April and May of 2020. This will be an overview of survey results only, and additional details are available on our website at www.market-scope.com. MarketScope surveys U.S. knee, hip, shoulder, and spine surgeons each quarter in the U.S. Our objective is to gather information on surgical volume, surgical location, surgical technique, implant used, revisions required, use of robots, and plans for adoption of technology. Our Q1-2020 knee survey included 86 surveys covering 138 doctors. In some cases, one survey covered multiple doctors in a group practice setting. Knee replacement surgery was down an average of 6.5% during the quarter, primarily due to the COVID-19 epidemic. Recognition and response to the pandemic did not begin until the last 2 weeks of the quarter. We expect procedure volumes to decline 60% in Q2 2020 due to a combination of elective surgery bans, patient fears, lack of hospital capacity for elective surgery. Respondents reported that primary total knees accounted for 84.4% of total knee replacement procedures during the quarter, and that revisions to primary total knees accounted for 5.1%. Primary unicompartmental knees totaled 8.2% of procedures, with uni revisions accounting for less than 1%. Patellofemoral joint replacements were 1.4% of total reported procedures. On average, respondents reported performing 31.3 knee arthroplasties during the quarter, with only 2.5% of doctors reporting more than 150 procedures during the quarter. The COVID-19 pandemic impact began at the very end of the quarter, and impact was marginal, with about half of respondents reporting no change in procedure volumes when compared to Q1 2019. However, 27.8% reported a decrease in procedure volume, and only 22.2% reported an increase in volume. Of those reporting an increase in procedures, the average increase was 4.3%, while those reporting declines in procedure volume reported an average of 24.9%. Osteoarthritis is a primary reason for knee replacement surgery, accounting for 95.2% of patients, according to survey respondents. Respondents also said that almost 64% of patients were over the age of 65 during the quarter, and only about 10% were under the age of 55. Surgeons have strong preferences for knee implant features. We asked participants to rate the importance of 5 implant features on a scale of 1 to 5, with 5 is very important and 1 is not important. Surgeons rated posterior stabilization, revision model availability, and cruciate retaining options as the most important criteria. Antioxidant infused bearings and cementless fixation options were rated as less important. Opinions on unicompartmental knee replacement vary widely. Of those responding to our survey, 55% said that they performed at least one unicompartmental knee replacement during the quarter. However, most doctors performed few procedures, and overall unicompartmental procedures accounted for only 8.2% of total procedures. When asked about future plans, 79.1% said they did not plan to change their share of uni procedures, and 16.3% said that they would increase the share of unis. 4.7% said they planned to decrease their share of uni procedures. Survey respondents said that aseptic loosening and infection were the primary reasons for revisions, accounting for 35.7% and 23.7% of cases respectively during the quarter. Knee surgeons said that 53.9% of their revision cases were more than 10 years following surgery, and only 3.7% of revisions were within the first 90 days following surgery. The use of robots in navigation is growing in the U.S., driven by the promise of lower complications, improved patient results, and longer implant survival. Respondents reported using robots in 12.8% of cases during Q1 2020. 20% of surgeons said that they use robots currently, and another 10.6% said they plan to adopt the technology in the next 12 months. About 65% of respondents said that they did not plan on using the technology in the next 12 months. The COVID-19 pandemic is a pressing issue for knee surgeons, and it prevents them from taking care of their patients and threatens the survival of many practices. More than 90% of respondents said that they expected lower surgical volumes in Q2 2020 as a result of the pandemic. Hospital and ASC availability was ranked as the most important pandemic-related barrier. Patient fears were also highly rated. This presentation is only a partial report on results. Our surveys are performed each quarter, and our complete survey reports include comparisons to preceding quarters and relevant crosstab comparisons. Our surveys are conducted immediately following the end of the quarter and are open for 30 days, with results available 45 days following the end of the quarter. This is offered as a subscription service. Additional data from this survey, information on subscription, or participation in the service is available on our website at www.market-scope.com. You can also reach me directly at daveharmon@market-scope.com or 314-400-7634 with additional questions. Thanks for your attention.